How's it going, guys? Medium difficult question, Immuno, step 1, 26-year-old woman, formative history, intermittent palpitations, heat intolerance. ECG shows signs of tachycardia, physical exam, abdominals, BMI 23. Obvious diagnosis of Graves' disease here, so hyperthyroidism, increased T3, T4, suppressed TSH. Question wants to know which of these answer choices is most immunologically similar to Graves'. Let's just hop through choice A to P, wrong fucking answer. It's type 1 hypersensitivity constellation, classically asthma in the winter, hay fever, rhinoconjunctivitis in the spring, atopic dermatitis, aka eczema, in the summer. Type 1 hypersensitivity is when you have IgE on the surface of mast cells and basophils that will bind antigen at Fab fragments. The IgE will juxtapose the mast cells, basophils degranulate, release histamine. Choice A, wrong fucking answer. Choice B, contact dermatitis, wrong fucking answer. It's type 4 hypersensitivity, it's T-cell mediated. So highest yield for USMLE is going to be weeds, poison oak, ivy, sumac. Tell you patient when hiking and has a linear row of vesicles. Very buzzy, linear row of vesicles for brushing up against weeds. Sunscreens, type 4 hypersensitivity. They can say vesicles on the dorsums of the hands, arms, face. Latex allergy. Okay, very high yield type 4 hypersensitivity. They'll say someone working in an anatomy lab or a nurse. Okay, implication is they're wearing gloves. Also, contact dermatitis can be things like nickel on watches. Wrong fucking answer. Choice C, heparin-induced thrombocytopenia, HIT, correct answer. It's type 2 hypersensitivity. So Graves' disease is where you have the formation of TSI, thyroid stimulating immunoglobulin, which is the name of the antibody that binds to and activates TSH receptor, causing hyperthyroidism. So a type 2 hypersensitivity is when you have antibodies against your own tissues, cells, receptors. Well, HIT, platelets are cells. Okay, so someone's administered heparin, such as for a DVT, it's going to get thrombocytopenia. So patient's going to have the development of antibodies against the heparin platelet factor 4 complex. Okay, so heparin hyphen PF4 complex. And as I said, it can sound like a type 3 hypersensitivity where it looks like antigen antibody complex is forming in the blood, but platelets are cells. Okay, it's a type 2 hypersensitivity, not type 3. You can also be aware of other high-yield type 2 hypersensitivity, such as bullous pemphigoid, pemphigus vulgaris, pernicious anemia. Okay, I'll link my high-yield immunology PDF below, obviously. So choice D, PSGN, wrong fucking answer, type 2 hypersensitivity. Okay, so antigen antibody complexes depositing in the kidney in this case, so subepithelial deposits. Type 3 hypersensitivity could also be the malar rash for lupus, could be arthus reaction, could be serum sickness. Wrong fucking answer. Choice C, vitiligo, wrong fucking answer. Doesn't even refer to a hypersensitivity, but if we were to attach one to it, it would be type 4 because it's a T-cell mediated destruction of melanocytes, okay? So a couple factoids I could tell you is that one, autoimmune diseases go together. I've talked about this a lot in my clips where USMLE might give you type 1 diabetes, ask you what the patient's at risk for, and the answer could be Hashimoto or pernicious anemia. Okay, you just got to know. Don't worry about strict HLAs. But if a patient has one autoimmune disease, they're at increased risk for others. And USMLE really likes vitiligo as associations. Okay, so for example, they can give you a patient who has vitiligo and has a hypersegmented neutrophil, and they're trying to tell you that it's B12 deficiency due to pernicious anemia because autoimmune diseases go together. So that's the first factoid I could tell you, just that they like vitiligo with autoimmune disease going together. The second is that for vitiligo, because it's T-cell mediated destruction of melanocytes, you're going to choose a down arrow for melanin production and a down arrow for melanocyte number. And this is in contrast to albinism, where we have normal melanocyte number, holy shit, and decreased melanin. Choice C, wrong fucking answer. You know the deal. Until you make more content, I feel like my stuff's growing my channel. Appreciate your time. That's it.